Such a Jet Graham. I am going to do a YouTube video on part 2 of dementia and memory loss. Just to go back and recap a little bit, first of all, dementia is a reversible disease, somewhat, or better said, a preventable disease. Once it gets too far down the road, it's probably just about impossible to get it back to any kind of normal function. So what we're going to try to do is reverse this disease and improve it. Remember, dementia starts when you're age 30. It starts with a combination of memory loss, what we call moderate cognitive impairment, or MCI. And there's also some problems with attention deficit, confusion, and just plain forgetting things. So what we're going to talk about today is what we do to improve the system, to improve your brain. And so the slide you see in front of you is the binary neural electrical system, the order of it. So the first thing to talk about is the dopaminergic or catecholamines, and also the GABAergic and the serotonergic. Those work together in a positive and negative response. Now they also talk about the endorphins, which are similar to opioids. But those can be released with exercise and some other things, and that's probably why exercise does help. Now, this neuroscientist by the name of Clark Rant showed that adrenaline helps memory. So we know that a stimulant is going to help your memory. Also, other things that can increase the brain speed. And I guess when we talk about memory, we're talking about the speed of the brain and how fast it functions. So in order to improve that function, we're going to try to do what we call neurogenesis, which means growing new brain cells. So here you can see in this slide that hormones are going to enhance your brain speed. Many of the same hormones associated with increasing processing speed are also associated with neurogenesis, or growing new brain cells. Now, HGH, which is your human growth hormone, is involved in that. HGH starts going down at age 30, and that's why you start losing brain function at age 30. Pregnenolone, which you can get as a supplement, can help with neurogenesis. These hormones make it possible to grow smarter as we grow older. Now, the problem with HGH supplements, first of all, it takes 6 months to feel a response. The second thing is about $1,000 a month to take that medication. So it's very expensive, and then it takes a while to get there. You can also support HGH, or human growth hormone, by taking testosterone. We've got study that shows that the testosterone pellets that keep your level up around 1,000 to 900 in the males will significantly improve neurogenesis. There's also antidepressants that can help with improving brain speed. It improves P3 latency. Latency is kind of the opposite of what you're thinking. They're measuring the slowness of how fast you react. It also can even improve brain atrophy. So when we do CT scans in the hospital, if somebody comes in, they're 70, 80 years old, the radiologist will frequently comment on either normal brain aging atrophy or abnormal atrophy. Either way, that's the problem. Also, your parathyroid hormones go up as you get older, and that's also correlated with slowing down of the brain. So controlling your parathyroid hormones is important, and that's age-related. We're going to show you later what hormones matter at different ages. We'll get into that. Hyperparathyroidism and osteoporosis basically go together and causes calcifications in the brain and body. We also know that supporting your hormone system, especially testosterone and estradiol, as long as it's done in a balanced form, can decrease your aging process by 15 years. So we can make you 55 when you're 70. Thyroid hormones are also known to modulate the adult hippocampal neurogenesis, and that was shown in the study of rats. So stimulating you with T3, getting that up to normal, can significantly improve your brain speed. Hypothyroidism is associated with poor concentration, memory disturbances, depression, and decreased cognitive function. It has also increased slowing down of the brain. So replacing hormones, estrogen replacement in menopausal women has led to significant improvement in information processing, and that was measured by a P3 latency, or slowing down of the brain function. When they talk about P3 latency, what they're doing, they're talking about measured, basically a measurement when they do it in EEG. So this is something that your neurologist can actually remember, or can actually measure. Now, they've got studies that shows that estrogen pretreatment attenuated the anticholinergic drug-induced impairments on intention tests. So in other words, they did an intention test that they pre-medicated with the anticholinergic drug. Well, the estrogen pretreatment basically counteracted that. The other thing we know is that taking anticholinergic drugs now, like your wonderful drugs for overactive bladder, I guess I wouldn't take those, because those all cause dementia. There were some studies that just came out on that. You can look that up. Serum testosterone levels positively correlate with brain speed and have been shown to enhance adult hippocampal neurogenesis. I myself, I want my testosterone level at 1,000. I want to max that out. So that's why we're strongly recommending that everybody get their hormones up, males get their testosterone up, and females get it up. Males should have their testosterone at around 1,000, somewhere between 900 to 1,100. You're never going to get there with topicals or the testosterone cypionate injections. Testosterone cypionate, it may get it up there, but only for 2 to 3 days, and it's going right back down. Androgen therapy may thus be used to prevent Alzheimer's, dementia, and other forms of cognitive decline. That is the point of this YouTube video. Androgen therapy may be used to prevent Alzheimer's, dementia, and other forms of cognitive decline. So if you're losing your memory, you need testosterone.